ਸਵਾਗਤ ਕਰਦੇ ਹਾਂ ਜੀ ਇੱਕ ਵਾਰ ਫਿਰ ਆਪ ਸਭ ਦਾ ਅੱਜ ਦੇ ਇਸ ਸੈਗਮੈਂਟ ਵਿੱਚ। ਮੇਰਾ ਸਾਥ ਦੇਣਗੇ ਐਲਨ ਗਲੈਸਰ ਜਿਹੜੇ ਕਿ UBC ਦੇ ਵਿੱਚ ਕਲੀਨਿਕਲ ਇੰਸਟ੍ਰਕਟਰ ਨੇ ਤੇ ਮਾਰਕਸ ਫਾਰਮੇਸੀ ਦੇ ਵਿੱਚ ਇਹ ਫਾਰਮਾਸਿਸਟ ਨੇ। ਅੱਜ ਦਾ ਸਾਡਾ ਵਿਸ਼ਾ ਰਹੇਗਾ ਕਿ ਟਾਈਮਿੰਗ ਤੇ ਡੋਸੇਜ ਦੀ ਕੀ ਇੰਪੋਰਟੈਂਸ ਹੈ। ਇੱਕ ਇਸ਼ੂਜ਼ ਦੇ ਵਿੱਚ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ ਸੀ ਕਿ ਦਵਾਈ ਕਿਵੇਂ ਖਾਣੀ ਚਾਹੀਦੀ, ਕਿਹੜੇ-ਕਿਹੜੇ ਤਰੀਕੇ ਨੇ ਦਵਾਈਆਂ ਦੇ, ਪਰ ਖਾਸ ਤੌਰ ਤੇ ਜਦੋਂ ਟਾਈਮਿੰਗ ਤੇ ਡੋਸੇਜ ਦੀ ਗੱਲ ਕਰਦੇ ਹਾਂ ਉਸ ਦੀ ਕਿਹੜੀਆਂ ਚੀਜ਼ਾਂ ਨੇ ਸਾਨੂੰ ਪਤਾ ਰੱਖਣਾ ਚਾਹੀਦੀਆਂ ਨੇ ਤੇ ਜਿਸ ਦਾ ਸਾਨੂੰ ਬੈਨੀਫਿਟ ਮਿਲ ਸਕਦਾ ਹੈ। ਸਵਾਗਤ ਕਰਦੇ ਹਾਂ ਐਲਨ ਗਲੈਸਰ ਦਾ। Welcome to the program.
Thank you, Harpreet.
Thank you. So in a previous episode, we had discussed about what kinds of ways we use to take the medicine, how it gets absorbed in our body, and we had just touched about the timing and the dosage aspect. So today, I would like to focus, because it's a very important point as you have been talking about it. When we talk about timing, tell us in details, what does timing mean, what is the importance, and if we do not follow that, what can be the negative results of that?
So, our drugs are tested, and most of the drugs you take have to be taken multiple times a day.
Right.
There are a few drugs you take once every 24 hours, so they're very simple.
Right.
The goal there is one every 24 hours. Now, I've shown a chart, hopefully it's on the screen, where you can see it always takes at least, say, half an hour, 20 minutes. You take the pill, takes a half an hour to get into your bloodstream, and the level of drug in the blood has to rise to a minimum effective level. Right. So nothing is instantly going to work, right? Okay. The only thing that's instant might be some cream on your skin that can, help kill the pain quickly. But when you take something by mouth, it's going to take at least 20 minutes to half an hour to get absorbed, pass through the stomach, get absorbed there, and then once it reaches its minimum effective concentration, because there's a concentration of drug in the blood that works for the majority of people, and below that there is no effect. You won't feel the pain relief. That's why it takes a half an hour to kick in, say, if you'd have to take a Tylenol. So once you've achieved that level of minimum effective concentration, you have to keep dosing. So it goes down over time. That's where the drugs are taken once every 24 hours. So if you start at noon, you take it every noon to maintain the effect you want. So for example, in an antibiotic, you're supposed to take 4 times a day. One of the older ones called amoxil, 3 or 4 times a day.
Right.
So if you take it 3 times a day, that's 3 times in 24 hours. So if you start at noon, the next dose would be at 8 in the morning. Right? 8 hours later, because the dose goes up and down. So when you take it at 8 hours, you're going to maintain the minimum effective concentration of this antibiotic called amoxil to kill the infection in your body.
Right.
What if you miss the dose? What if you decide, I'm going to take it either earlier or later?
Right.
What's going to happen if you decide to take that at 10 o'clock at night instead of 8? You've now left a 2-hour gap where the bacteria don't have enough drug in the blood to affect them, to make them go into a smaller amount and cause less problems to you. They can actually multiply. Okay. And they actually can become resistant to that
That's really interesting, because generally, like afternoon, we do not, take the medicines on time, most of the time. Like it's not that if on Monday you have taken it at 12 noon, that tomorrow again you're going to take it at 12 noon, maybe it's 11 or maybe it's 3 also. Yes. So what you are saying is that time difference also makes a difference, and that affects your health.
Exactly. You won't see, typically in an antibiotic that's going to work, within 24 to 48 hours, you feel better. That the symptoms, say if it's a head cold or a chest cold, all of a sudden within 2 days you start to breathe easier. It's you're not coughing up all as much phlegm, etc. That's typically how quickly our antibiotics work. But if you don't take it on time, you might still have that infection day 3, day 4, day 5. You go back to the doctor, says, "Doctor, this didn't work." And he'll say, "I don't know why. It's supposed to." "Well, we'll try a different one." And what happened, and this happens with so many patients, we're looking still at 50% of the patients don't adhere to the medication schedule, whatever it is. So they don't get the full benefit of the drug.
Okay.
So that's just in antibiotics. What if you're on a blood pressure pill? Well, if you don't take it on time, it says twice a day, about every 12 hours, you're going to have a problem in that your blood pressure will start to rise. What are the consequences of rising blood pressure? Well, there's more stress in your heart. there's more stress on your kidneys. They can be damaged.
Right.
You now have an increased risk of stressing on your blood vessels. You could have a stroke. You can have a heart attack. You can damage your kidneys. So this principle of timing is extremely important to your health, because you're taking it either for an infection, or if you have high blood pressure, you're taking it to control that.
Right.
What are the consequences of not following that? That's the scary part that people don't understand. Yes, you may be okay for a day or two, but years of doing this not correctly leads to the failure of the medicine, and then we can't help you. Right?
Right. And when it is so important that the timing has a great impact on us, generally, you know, as you very rightly said, the long-term consequences can be really bad for us. But as far as the dosage is concerned, if you could focus on that and tell us a little bit more in details about that also, because again, when we are taking the medicine, that's great, but many times we skip it, as you said, or the timing is not there. But dosage also, we reduce it, or many times we also increase it, that maybe this will help us recover fast.
That's right. So, great question. There's always consequences for not following it. Now, we know, based on science, based on experimenting with people and animals, studies before the drug comes onto the market, that we know what dose works the best for the majority of people. Sometimes, in some places, I don't know if you've got the chart up, the difference, if you just double the dose, you can actually start doing harm to your body. For example, if people are on a drug called warfarin, or any blood thinner, there's a very narrow range at which warfarin will work, and warfarin thins the blood to prevent strokes and heart attacks. If you take too much, what's the consequence? Internal bleeding, and you might bleed in your stomach. You're going to bruise easily on the skin. If you cut yourself, it'll bleed. You may have to end up in emergency and get even transfused because of this excess bleeding. That's all for someone deciding, oh, if one's good, two's better. Not true. Need to avoid doing that. That's a consequence of a prescription drug. If we take something like an over-the-counter drug, the one of the most dangerous ones to take too much of is acetaminophen, brand name Tylenol. If it says the maximum dose is 2, that's true. If you decide to take 4 because you think 2 is okay, but 4 would be better, not true. At 4, you're now starting to destroy your liver cells. There is liver damage happening. As a matter of fact, through my research and studies, if you're, say, over 70 years old or 75 years old, I would recommend, the manufacturer says 4,000 milligrams a day, which is about their 500 milligram tablets. So that's 8 tablets a day. I recommend you just take 6 tablets a day max, because you start looking over the long term of taking high doses of damaging your liver. So that's why dosage, what we've recommended, is accurate and helpful for 90% of the population. Avoid going up. Same thing about people. I've seen them decide that they're going to take their blood pressure pills, and they think, well, I don't need to take 2, I only need to take 1. Well, again, if you only take 1, you might only work half the day. So 12 hours you have blood pressure protection, and the other 12 hours you don't. And so that leads you to a higher risk of heart attacks, strokes, kidney failure. So the serious consequences of not adhering to the dosage. It's there for a reason, and it's a good reason.
So the prescriptions, whichever are given, have to be followed according to the prescribed rule as by the doctor.
That's right.
Let's go for a short break. I want to come back and discuss another issue which is related with this, especially in our community. It is like, for example, I have been recommended some dosage by the doctor, but somebody else comes and says, oh, I'm taking this medicine and it has helped me out. I start taking that also. So when we combine different kinds of medicines, what impact does it have on our body? Should we do it or not? We'll learn from you after this short break. ਹੁਣ ਤੱਕ ਜੋ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ ਉਸ ਵਿੱਚ ਸਾਡੇ ਮਹਿਮਾਨ ਐਲਨ ਗਲੈਸਰ ਨੇ ਦੱਸਿਆ ਹੈਗਾ ਡੋਸੇਜ ਤੇ ਟਾਈਮਿੰਗ ਦੀ ਜਿਹੜੀ ਇੰਪੋਰਟੈਂਸ ਹੈਗੀ ਹੈ, ਕਿਉਂ ਜ਼ਰੂਰੀ ਹੈਗਾ ਕਿ ਜੋ ਡਾਕਟਰ ਨੇ ਪ੍ਰਿਸਕ੍ਰਾਈਬ ਕੀਤਾ ਹੈ ਉਨਾ ਹੀ ਲੈਣਾ ਚਾਹੀਦਾ ਹੈਗਾ। ਟਾਈਮਿੰਗ ਦੇ ਵਿੱਚ ਜੇਕਰ ਅਸੀਂ ਆਮ ਤੌਰ ਤੇ ਦੇਖਦੇ ਹਾਂ ਕਿ ਜੇਕਰ ਲਿਖਿਆ ਗਿਆ 1-2 ਟੈਬਲੇਟ ਸਵੇਰੇ ਬ੍ਰੇਕਫਾਸਟ ਨਾਲ ਲੈਣੇ ਨੇ, ਲੰਚ ਨਾਲ ਲੈਣੇ ਨੇ ਜਾਂ ਡਿਨਰ ਨਾਲ ਲੈਣੇ ਨੇ, ਤਾਂ ਅਸੀਂ ਕਈ ਵਾਰੀ ਸਾਡਾ ਜਿਹੜਾ ਪੈਟਰਨ ਹੁੰਦਾ ਉਹ ਸਹੀ ਨਹੀਂ ਰਹਿੰਦਾ। ਅਸੀਂ ਕਈ ਵਾਰੀ 10 ਵਜੇ ਬ੍ਰੇਕਫਾਸਟ ਕਰ ਰਹੇ ਹਾਂ, ਕਦੀ 12 ਵਜੇ ਕਰ ਰਹੇ ਹਾਂ। ਤਾਂ ਇਹਨਾਂ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਉਹ ਜਿਹੜਾ ਵੇਰੀਏਸ਼ਨ ਹੈਗੀ ਹੈ ਉਸ ਦਾ ਅਸਰ ਪੈਂਦਾ ਸਾਡੇ ਉੱਤੇ ਤੇ ਸਰੀਰ ਨੂੰ ਨੁਕਸਾਨ ਹੁੰਦਾ ਬਜਾਏ ਕਿ ਫਾਇਦਾ ਹੋਏ। ਦੂਸਰਾ, ਡੋਸੇਜ ਦੇ ਸੰਬੰਧ ਵਿੱਚ ਵੀ ਇਹਨਾਂ ਨੇ ਇਹੀ ਦੱਸਿਆ ਹੈ ਕਿ ਜੋ ਪ੍ਰਸਕ੍ਰਾਈਬਡ ਤੁਹਾਨੂੰ ਦੱਸਿਆ ਗਿਆ ਉਹੀ ਫੋਲੋ ਕਰੋ। ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ ਵਾਪਸ ਆ ਕੇ ਹੋਰ ਜਾਣਕਾਰੀ ਲੈਣੇ ਆ ਐਲਨ ਗਲੈਸਰ ਤੋਂ। ਸਾਰੀਆਂ 에ਅਰਲਾਈਨਸ ਦੀਆਂ ਟਿਕਟਸ ਤੇ ਬਿਹਤਰੀਨ ਕਸਟਮਰ ਸਰਵਿਸ ਲਈ ਮਸ਼ਹੂਰ ਹੈ ਸਪ੍ਰਿੰਗ ਟਰੈਵਲਸ। ਇੰਡੀਆ, ਪਾਕਿਸਤਾਨ ਜਾਂ ਕਿਸੇ ਵੀ ਮੁਲਕ ਦੀਆਂ ਟਿਕਟਸ ਤੁਸੀਂ ਇੱਥੋਂ ਵਾਜਬ ਕੀਮਤਾਂ ਤੇ ਲੈ ਸਕਦੇ ਹੋ। ਪੈਕੇਜ ਟੂਰਸ, ਕਰੂਜ਼ਸ, ਗਰੁੱਪ ਟਰੈਵਲਸ, ਹਨੀਮੂਨ ਪੈਕੇजेस ਲਈ ਸਪੈਸ਼ਲ ਪ੍ਰਾਈਸਿਸ ਆਫਰ ਕਰਦੇ ਹਨ। ਹੁਣ ਆਨਲਾਈਨ ਟਿਕਟਸ ਵੀ springtravels.ca ਤੇ ਜਾ ਕੇ ਬੁੱਕ ਕਰਵਾ ਸਕਦੇ ਹੋ। ਸਰੀ ਤੇ ਐਬਟਸਫੋਰਡ ਵਿੱਚ ਇਹਨਾਂ ਦੇ ਦਫ਼ਤਰਾਂ ਵਿੱਚ ਆ ਕੇ ਅਜ਼ਮਾ ਕੇ ਵੇਖੋ। ਯੂ ਵਿਲ ਫੀਲ ਦ ਡਿਫਰੈਂਸ। Surrey office 604-501-4040, Abbotsford office 604-556-4000. Once again, welcome back to the program. ਐਲਨ ਗਲੈਸਰ ਸਾਨੂੰ ਦੱਸ ਰਹੇ ਨੇ ਕਿ ਕਿਉਂ ਮੈਡੀਸਿਨਸ ਦੇ ਵਿੱਚ ਜਦੋਂ ਟਾਈਮਿੰਗ ਤੇ ਡੋਸੇਜ ਜਿਹੜੀ ਇੰਪੋਰਟੈਂਸ ਹੈਗੀ ਹੈ ਉਸ ਨੂੰ ਸਾਨੂੰ ਫੋਲੋ ਕਰਨਾ ਚਾਹੀਦਾ ਹੈ। ਆਓ ਕੁਝ ਹੋਰ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ। So before the break, Alan, as I asked you, you have a wide experience, over 40 years being a pharmacist. You must have seen this thing. I do not know about many communities, but in the South Asian community, it's a normal thing, and especially in our community, it is that if I'm taking some medicine for something, and somebody comes, a friend of mine comes, or my relative comes and tells me, "Oh, come on, what are you doing? I have taken this medicine, and it helped me out. Maybe it's a herbal medicine or some other thing." So I start taking along with the prescription which I am taking. What is your thought on this?
It's a great question.
Thank you.
Harpreet, because it's very common. So, as a pharmacist, I have to have access to information on all the natural products,
Right.
and how they interact, how they react, hold hands or fight our prescription drugs. Now, for example, if you're on a prescription drug to thin your blood,
Right.
whatever kind it is, many different herbal products will also thin the blood. So unless you check, with the pharmacist, or you can come to Mark's Pharmacy, 80th and 120th Street in Delta, we can look up and double check if that natural herbal medicine
Right.
is going to make a difference to your prescription drug. Here's a consequence. If you're taking warfarin, two things will happen. One, the warfarin is going to make your blood thinner, so then you risk of a bad bleed, bruising. Okay, that's number one consequence. Number two consequence is that natural product could stop the warfarin from working, and then you're at increased risk of having a stroke or a heart attack or kidney failure.
Right.
So you want to avoid those consequences. So whenever you're on a prescription drug, I strongly recommend you consult. Your friend is great in their particular case, because everybody's different.
Absolutely.
The natural product works for them, doesn't interfere with anything else they're taking, fantastic.
Right.
But in your case, you need to see how it is for you, because everyone's unique.
Absolutely.
And that's the whole thing. So a consequence of like some high blood pressure medication, or it might even raise your blood pressure. Something as simple as saying, for aches and pains, if you start taking ibuprofen, or you start taking aspirin because you got an ache and pain, and you're on a high blood pressure medication, in 25% of the cases of people who take the Aleve, the naproxen, the ibuprofen of the world's, it increases their blood pressure. And if you're taking this every day,
Right.
and you're not being monitored every day by the doctor, you're visiting him, once every 6 months or once a year, you now have a situation where the blood pressure medication isn't working 100%.
Right.
Your pressure's up. What does that mean to you? You got increased risk of strokes, heart attacks, and kidney disease. So that's really important to you, to make sure your over-the-counter or natural supplement doesn't fight
Right.
your prescription drug.
That was interesting. Thank you very much for this information. It really helps our viewers know about this, because as you said, prescription which is taken, you can take more consultation from the pharmacist, and on 80th and Scott Road, they can come to you and get a free advice from you regarding that medication is going to be helpful to them or it is going to be detrimental to them. Thank you for your time.
You're welcome.
ਐਲਨ ਗਲੈਸਰ ਨੇ ਦੱਸਿਆ ਸਾਨੂੰ ਕਿ ਜਿਹੜੀ ਤੁਸੀਂ ਮੈਡੀਸਿਨ ਲੈ ਰਹੇ ਹੋ ਉਸ ਦੇ ਨਾਲ ਆਮ ਤੌਰ ਤੇ ਇਹੀ ਹੁੰਦਾ ਹੈ, ਸਾਨੂੰ ਕਈ ਵਾਰੀ ਕੋਈ ਕਹਿ ਦਿੰਦਾ ਕਿ ਜੀ ਇਹ ਮੈਡੀਸਿਨ ਨਾਲ ਖਾ ਲਓ ਠੀਕ ਹੋ ਜਾਓਗੇ, ਤੇ ਅਸੀਂ ਖਾ ਲੈਂਦੇ ਹੈਗੇ ਆ। ਤੇ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਨਹੀਂ, ਇਹ ਬਿਲਕੁਲ ਤੁਹਾਨੂੰ ਨੁਕਸਾਨ ਪਹੁੰਚਾ ਸਕਦੀ ਹੈ। ਫਾਰਮਾਸਿਸਟ ਕੋਲ ਜਾ ਕੇ ਤੁਸੀਂ ਉਸ ਨੂੰ ਚੈੱਕ ਕਰਵਾ ਸਕਦੇ ਹੈਗੇ ਹੋ ਅਤੇ ਉਸ ਦੇ ਵਿੱਚ ਇਹ ਦੇਖੋ ਕਿ ਕੀ ਜਿਹੜੀ ਤੁਸੀਂ ਮੈਡੀਸਨ ਲੈ ਰਹੇ ਹੋ, ਜਿਸ ਤਰ੍ਹਾਂ ਇਹਨਾਂ ਨੇ ਐਗਜ਼ਾਮਪਲ ਦਿੱਤਾ ਕਿ ਤੁਹਾਡਾ ਖੂਨ ਥਿਨ ਕਰਨ ਵਾਸਤੇ ਬਲੱਡ ਥਿਨਰ ਜਿਹੜਾ ਹੈਗਾ, ਬਹੁਤ ਸਾਰੀਆਂ ਮੈਡੀਸਨਸ ਅੱਜ ਅਵੇਲੇਬਲ ਹੈਗੀਆਂ, ਪਰ ਜਦੋਂ ਅਸੀਂ ਹੋਰ ਲੈਂਦੇ ਹਾਂ ਨਾਲ ਮੈਡੀਸਨ, ਉਸ ਦਾ ਕੀ ਫਾਇਦਾ ਹੈ ਜਾਂ ਨੁਕਸਾਨ ਹੈ, ਉਹ ਇੱਕ ਫਾਰਮਾਸਿਸਟ ਹੀ ਦੱਸ ਸਕਦਾ ਹੈ।